So, as the focus of public health is prevention and intervention, let's look at three different levels of prevention that we address in public health. They are primary, secondary, and tertiary. Primary prevention is trying to prevent an illness or injury from occurring at all. So, an example of this might be providing condoms to students, to college students. You can go to the Student Health Center and get them free of charge. We're trying to educate students in terms of safer sex. So, this would be primary prevention because we're trying to do something to help keep people from getting sexually transmitted infections. Secondary prevention minimizes the severity of the disease or injury once it's occurred. So this is generally where screening comes in. We might have a event where we encourage college students to get themselves screened for sexually transmitted infections. So that would be secondary prevention. We don't assume that everyone has one, but we're trying to identify someone who might have one so that they can get treatment. And then tertiary prevention is minimizing the disability by providing medical care and rehabilitative services as necessary. So this would be once someone has been identified, trying to reduce the injury caused by the disease. And in this case, it would be a sexually transmitted infection. So we would want to make sure that we get them antibiotics if it's a bacterial infection, if it's a viral infection, depending upon what it is, get them treatment if it's available. The next thing I want to talk about is the public health approach. And this is sometimes called PERI, P-E-R-I, and it's a 5-step cycle where the first thing we do is we define the problem. So the first P in PERI is problem. Oftentimes, the assistance of an epidemiologist is important in defining the problem because they can look at data and help us to understand it in terms of the definition of the problem. We then look at the etiology. Epidemiologists also help us with this. This is where we're looking for the cause of the problem. We're identifying risk factors associated with the problem so that we understand the problem to a greater extent. After we know the etiology, we come up with recommendations and we develop and test some kind of community level interventions that address the etiology of the problem. And then that's followed by implementation. That's where the rubber hits the road and we implement our intervention, and that is followed by evaluation. We always monitor our evaluations and assess their effectiveness. If it's an effective intervention, what we might do is continue it. But if it's not, we need to discontinue it because that is a waste of public funds to continue something that's not working. It also, in that evaluation, the result might be that we change our intervention slightly to increase its effectiveness, and then we go through the cycle again. Another public health concept I want to introduce to you is the determinants of disease. And this should really say disease or disability because when we look at the burden of disease, we're also looking at injury. If people get injured and they have reduced functionality. So this is something that I borrowed from Dr. Richard Riggleman and his textbook, Public Health 101. But he presents the determinants of disease as big GEMS. So behavior, infection, genetics, geography, environment, medical care, social, economic, cultural factors. So let's go over these briefly. So behavior implies actions that increase exposure to the factors that produce the disease or protect the individual from disease. Actions such as cigarette smoking, exercise, diet, alcohol consumption, unprotected sex, seatbelts. These are all examples of ways that behaviors help determine the development of disease. With infection, infections are often the direct cause of disease. We are increasingly recognizing that early or long-standing exposures to infection may contribute to the development of disease or even protect against disease. So diseases as diverse as gastric and duodenal ulcers, gallstones, or cancers originating in the liver are increasingly suspected to have infections as an important determinant of the disease. With genetics, we've really had a revolution in genetics, and it has focused our attention on the role of genetic factors, what these genetic factors play in the outcome of disease. And so even when contributory causes such as cigarettes have been clearly established as producing lung cancer, sometimes there are genetic factors that also play a role in the development and the progression of these types of diseases. So with geography, the next G, geographic location influences the frequency and even the presence of a disease. So infectious diseases such as malaria, Lyme's disease, these occur only in defined geographic areas. So geography may also imply local geographical conditions such as those producing high levels of radon, which is a naturally occurring radiation that contributes to development of lung cancer. Sometimes with basements, you have a high exposure to these kinds of radioactive, naturally occurring elements. So the E is for environment, and environmental factors determine disease and the course of the disease in a number of ways. So we have an unaltered or natural physical world around us that may produce disability and death from sudden natural disasters, things like earthquakes or volcanic eruptions. Sometimes there are iron deficiencies due to low iodine content in the food that soil, the soil, I should say, that food is grown in. We also have what we call an altered physical environment. That's something that humans produce, and there can be exposures to toxic substance in occupational and non-occupational settings. So the physical environment built for humans to be used by humans, we call the built environment. And this produces determinants ranging from air pollution to infant-proofed homes or hazards on the highway. The M is medical care. So this has to do with access to and the quality of the medical care that a person can receive in determining how their course of disease progresses. And then there's socioeconomic cultural. So in the United States, social economic factors have been defined as education, income, and occupational status. These measures have all been shown to be determinants of disease as varied as breast cancer, tuberculosis, and occupational injuries. There's also cultural and religious factors that are increasingly being recognized as determinants of disease because beliefs sometimes influence decisions about treatment, in turn affecting the outcome of the disease. So we will return to Big GEMS. There's an activity I will have you do, and I will also provide you with the definitions of these.